Hey everyone, welcome back to another video. Today we have Mohammed with us and Yousif, and both of them are recent graduates from a medical college in UK, and they have joined us for a session to enlighten us about the clinical attachments that they have experienced in UAE. Could you go ahead and introduce yourself so everyone knows who you are?
Yeah, my name is Yousif, and I'm here to do an elective from the UK.
Yeah, my name is Mohammed, and yeah, I just finished medical school in the UK, and I'm here on my elective period.
And if you did not check it out, there are amazing influencers on all social media platforms like TikTok, Instagram, you name it, they are there. I'll put the handles below. You should check them out and follow them as well. Alright, before we start, Yousif, can you just tell us about your experience about the system in the UK and why did you choose UAE as your electives?
Yeah, well, as you know, the system in the UK is mostly publicly funded through the NHS. So I thought I first of all wanted an experience in an Arab country, just to get better at my Arabic speaking skills and see more Arab patients and Arab doctors. And also I think also the system in the UAE is a mix of public and private, so I wanted to see a bit more of the private side of things as well, just to see what that's like.
Okay, and which department did you join for clinical electives and which hospital was it?
In neurosurgery.
Neurosurgery,
Yeah.
and was it in
Mediclinic.
Mediclinic in Dubai?
Mm-hmm.
Alright, how was your experience like in Mediclinic?
Oh yeah, it was really great. The hospital was very friendly. Everybody in the staff was very friendly as well, and yeah, I really enjoyed it.
Perfect, and what about you, Mohammed?
So I'm at Shekih Khalifa Medical City, which is the same hospital that you work at, and I'm doing my ENT placement at the moment.
Okay.
And so yeah, I think similar reasons to Yousif. We actually go to the same university.
Oh, wonderful.
Yeah, so I wanted to experience an Arab country and see what the healthcare system is like in a Arab Muslim country compared to the UK. So I thought we'd do it in UAE.
Perfect. And which college are you from in UK, if you don't mind sharing that with us?
Yeah, we're from UCL, so University College London.
Okay.
And yeah, we've just finished
Perfect.
medical
That's
school.
really wonderful to know, because this video is out for everyone who wants to know about doing clinical attachments or clinical electives in UAE from whoever is studying abroad. And these are prime examples who have successfully completed and ongoing electives in this country. Alright, as a part of the reason why you're here for electives, what was the one thing that you were searching for before you came for electives in this country?
I think I was just searching for the opportunity, to be honest. So it's quite hard, it's quite difficult to find an opportunity in the Emirates, just because it's not like I don't feel like it's a very common thing. So it's very, it's quite about searching for elective opportunities, what hospitals allow you, what universities take up elective students, and just trying to apply for a position, because I feel like it's quite popular, and sometimes there isn't enough spaces as well.
Have you been to the UAE before, or is it the first time for both of you?
It's the first time for me.
Yeah, I only came here as a kid ages ago, so
Oh,
it's
wonderful.
basically first time.
Basically first time as a grown-up adult. That's really nice. And while doing clinical electives in this country, did you get to explore the city and side of the Dubai that people usually come to see?
Oh yeah, I tried to spend as much time as possible exploring Dubai and seeing all. There's a lot of attractions to see. So yeah, I tried to definitely make time for it outside the clinical placements. Go and see the big sites and doing a lot of activities, especially with Mohammed as well.
Wonderful. I think you have been touring the two major cities in this country, Abudhabi and Dubai.
Yeah.
That's really nice to hear. If I may ask, what was the procedure for you to apply for electives before you came here? How did you apply for electives?
Yeah, so we do it through the university. So I think we do it in stages. So stage one was like, just you have to find the place, like, where do you want to do it? And you just go online. If you know someone, it's even better. It's easier to contact the hospital. If not, you go online, and a lot of hospitals actually have like a portal online where you just apply formally. So I applied to a few different countries actually, because you don't know who's going to accept you.
Correct.
If they even have availability in the time period that you want to do it in. So I applied for Malaysia. I applied for Dubai as well initially, and I got a place in Dubai, and then it got cancelled, and then I applied for Abu Dhabi and got that. I also applied for a place in Saudi, which fell through as well. So it's quite a long process. So the first thing is contacting hospitals, and just like getting approval from the hospital. Of course, you need to fill in a lot of forms. University sends you a bunch of things that you need to do. But I think the longest part is actually contacting the hospital. So when I first sent an email to the hospital till I got full approval, it took about 1.5 to 2 months.
Oh,
So it's quite a long process.
How long before do you feel you should start this process if you're looking for a clinical attachment or electives?
I would say as soon as possible, to be honest. Like maybe like 6 months beforehand is a very good timeline. Even earlier for some placements, especially popular hospitals. Like for example, the Cleveland Clinic is very popular. If you are looking to do it there, then you're gonna have to look, at least a year beforehand, just because it seems like a lot of their spots are booked up quite quickly.
So on the applications, it actually has like a time frame. It's like, apply at least 2 to 3 months before. But like Yousif said, apply even earlier because people would have taken those spots up.
Those spots, all right. Okay. And for how long do you feel should be a clinical attachment or a period of rotation?
As in, our university allows us up to 8 weeks, and they recommend a minimum of 6 weeks. I think that's a good enough timeline, to be honest. I think 4 to 6 weeks in a placement is quite, a good amount of time to be able to acclimatise to the conditions, get used to the system, and then be able to get the most out of the placement as well.
You have studied in UK all your medical school, and now you did a clinical attachment in UAE. I think you might be able to differentiate about the system in the UK and the system in UAE. Did you find any similarities or differences while here?
I think a lot of the similarities are the fact that a lot of British doctors also practice in Dubai.
Correct.
So what I found is that a lot of, for example, the things that we learn in the UK about, taking a history from a patient, how to take a history examination, you see a lot of the British doctors here, bringing that over here and, continuing to practice in that way. So that was nice to see that kind of familiarity.
That's wonderful. And what about you, Mohammed? How did you like it?
Yeah, I think it's actually a lot more similar than I originally thought. So I think Shekih Khalifa Medical City is a public hospital, and a lot of it works very similarly to the UK in terms of, like you said, when patients come in, you have to take a history. Clinics are very, very similar, if not the same. The difference I saw is the clinics are a lot more, they're less specialist here. So in the UK, the ones that I've been to are very focused clinics. For example, I'm in ENT at the moment. There will be, for example, only ear clinics or nose clinics, something like that. Whereas here, it's all of ENT. Patients come in with a variety of problems, which is quite cool. It's a very interesting experience. You get to see a lot of different things. Surgery, again, very, very similar. I haven't really seen much difference, to be honest with you. So it's quite cool.
What are the departments you went to when you were in your ENT rotation? Like the clinics, the OR, and what other departments? Like, do you go for the ward rounds, morning rounds, or something like that?
No, so I've gone to the clinics and OR. That's all I've been to so far. And then after the OR, after surgery, you can go see the patients in recovery as well.
Okay, so the major that you were focusing on was the clinics and to see how the different cases have come into the hospital and then how they get treated in the OR. What about you?
Yeah, similarly, I think most of our patient workflow was through surgeries, clinics, and seeing the patient for follow-ups and on the ward as well. So I think that was quite useful as well because it's a very tailored patient experience. So you really do get to know the patients.
All right, and since you were in neurosurgery, so it was just basically focusing on spine surgeries and craniotomies, or how was it?
Yeah, most of my experience was with spine surgery because that is the highest patient presentation. It's like the most common.
Correct.
There was a few craniotomies and brain tumors, things like that, but most of the things it was spine and lumbar discs, and so common things are common.
How about the relation between the other people that work in the department, such as interns and residents? Have you interacted with any of them, and how was the working style between you and them?
Yeah, so in my experience, I've had, I think, interns who sit with me in the clinics, for example, and some of them even come into OR as well. But they do the same thing as me. Sometimes what they do is they get their own clinic room, and they get to speak to their own patients, but I have been given that responsibility, which is different to, of course, as a medical student in the UK, we can do that, but here, I think they just prefer me to just kind of like sit in with the doctor.
So that is one of the differences between the system and how you have practiced in the UK?
As in, I think it's just because I'm on a placement here,
Correct.
And it's a different country that they just don't want me alone with. They, like as a medical student in the UK, they will let you have your own clinics, talk to your own patients. Here, it's more of a, you get to sit in with the doctor. Like the whole point of this placement is you're with the doctor experiencing ENT.
Okay, so it's basically doctor focus, where you are with the doctor and what all the things that the doctor goes through the day, and you follow him around. Yeah,
exactly. So my placement is with one of the doctors. So whatever his schedule is like, it's going to be the exact same as my schedule. So I just follow him around. I get to do things with patients whenever he wants me to.
Perfect. And how about you?
Yeah, similarly, I think most of it was shadowing the fellow and several consultants as well, and trying to get as involved as possible. There wasn't many interns, but there were a few residents as well. So I worked with some orthopedic residents as well, and they were all very friendly and very welcoming as well. So it was nice to have a lot of experience with like interaction with that, and getting a bit of teaching in as well.
All right, that's really great to hear, by the way. One other thing that is very important to ask is, when you were applying for this process, was it a university sponsored process? You had to do things on your own, or was it paid, or how was the approach?
Yeah, I mean, there are several approaches that you can take. I mean, it depends on the institution. Some prefer that you email the institution directly. So, for example, the Cleveland Clinic has an official process which I tried to go through, but unfortunately that fell through. Other things that I tried was to email hospitals directly, but sometimes you don't get a response, or sometimes they don't take elective students. And also you can email doctors directly. So if you go on to a lot of hospital websites, they'll have like the clinicians that work there, and if you find, for example, a clinician that you're interested in their work or their research, it's quite good to send them an email, express your interest and tell them that you'd like to come shadow them for a bit. And a lot of them are quite friendly and welcoming.
Okay, that's really good to hear.
I think cost is actually a very important thing because first of all, every placement costs a different thing. So for example, I think we got quite lucky here because the way I applied for this elective was through a contact. So one of my friends' dad works in the hospital and he knows someone who knows someone.
Okay.
So it was through that, and so I got to do it for free. Whereas so I'm doing a split elective, so I'm doing 4 weeks here and then 4 weeks in Malaysia. Malaysia was through a formal application process, and through that formal application process, there's a fee that you have to pay.
Correct.
So I am paying, I can't remember the exact amount to be honest, but it's something around $250, $300 for the 4-week placement.
And there's also like things that you have to consider, like accommodation costs and food.
Yeah, so that's all separate as well that you got to consider, and that's something that you have to pay for yourself. There might be bursaries that you might be eligible for and you can apply for as well. So there's different things there's like elective bursaries, they might give you a few £100 to kind of help you with living costs and stuff like that. So you've got to take that into account. Like first of all, paying for the elective, pay for flights, for accommodation, living costs. It's quite expensive to live out for a period of 1.5 to 2 months.
Correct.
So you've got to consider all those things, and the country that you're in is obviously very important because UAE, for example, is a lot more expensive than Malaysia, which I'm going to hopefully next week. So
if you consider all the costs that you're going to have in hand, how much do you think would be affordable to do an electives for a period of a month here?
I think it depends obviously where you live, especially like where your elective is. Obviously, for example, maybe an elective outside Dubai in a different city might be a bit cheaper than the one in Dubai. Also, it depends what kind of accommodation you'd like. So I think it depends on somebody's budget. But I would say one of my top tips is to look for scholarships and bursaries really early on. Because after I got my place, I tried to look, and some of them had the deadline already passed. So it's very good to like look really early, preemptively, and just so you know what is there, what is out there. Your university will definitely be able to offer support as well in that regard. And I think that's just one of the most important things to look out for, because without that help, it does become a bit difficult.
Perfect, perfect. Would you recommend doing a period of clinical attachments in UAE to others who are watching this video with us right now?
I mean, I think if you're interested in that, if you're interested in the culture here, maybe if you're interested in the kind of system here, I think it's definitely worth it. I think I find it very valuable, just better understand the system. And it's also a very nice country to visit, a lot to do, and very nice and welcoming people like you.
Perfect, perfect.
yeah, the country's amazing as well, so there's a lot of places to visit. You won't get bored in UAE.
Definitely, and I think if someone is coming here for a period of 1 month, it's quite enough time to get accustomed to the system as well, to go around, make new connections. I think it's really important when you're working in a healthcare field, right?
Yeah, definitely, definitely.
What other extracurricular activities were you involved in apart from your electives? Did you get any chance to do any researches, or did you get any chance to go into any of these fields?
I mean, I'm only here for a short period of time, so I was offered, some like to help out with some research and that kind of thing. But I found that I focused a lot more on just getting the clinical experience and enjoying the country. Just because it is a once in a lifetime experience, and I wanted to make the most of that. But if you are keen and you do want to get involved in that, I'm sure there will be opportunities as well.
All right, and Mohammed?
Exact same thing. Like in terms of research, this is something that we can do when we're back in the UK with there's research groups that you can be part of. But here in UAE for my elective, again, I'm just focusing on my clinical experience.
Correct. So there is a chance for exposure to research with the doctors you're working with, and you can get accustomed to these pathways as well if you are doing attachments here.
Yeah, it completely depends on who you're working with, to be honest. Like if
Okay.
the doctor is doing research and wants medical student help, then he can offer it to you. But again, you should be proactive and ask for that kind of stuff if you want to.
So if I would want you to explain to me in a timeline how your day was in the day of a clinical attachment in neurosurgery, what would you say? What were the events?
I think, for example, it depends on the day. But let's say, I guess a busy day would be that we'd have to get into the hospital for 8 o'clock. That's when surgery starts. So you'd get in for maybe like 7:45, get changed. Depends on what the list was. Scrub in, maybe watch the surgeries. Get involved, try to ask questions. There'll probably be maybe 1 or 2 cases, maybe 3 on a busy day. Afternoon, usually there's clinics. So you'd go to the clinic, and the clinics usually run till 4 or 5. And I guess that would be like a brief overview. Obviously, in between, you'd go see the patients from the previous day or the previous surgeries, check in on them in between. It's been Ramadan, so there hasn't been like a lunchtime or anything like that, just because we're fasting.
And what about you, Mohammed?
I think it's very similar, to be honest. Again, because the Ramadan schedule, the way it works here, they've got morning clinics and then they've got really late evening clinics. So clinics that start around 10 p.m.
Okay.
So I mean, we can go to that. I went to it once. But yeah, like a busy day would be let's say it's a surgery day. You go in the morning, you need to go in there for 8:30 a.m., which is usually when the surgery starts. For ENT, there's usually around 4 surgeries a day. So you can scrub in for those, and yeah, you just see the patients afterwards and go home.
How did you manage your schedule during Ramadan? Since you just mentioned it was Ramadan, how was the rotations during Ramadan? And was it too much, or was it easy going, or how was it?
I think it's just about settling in. I think at the start it was quite difficult, especially with the sleep schedule and being a bit jet lagged. But I think you get into the routine afterwards, and having a nap always helps. I mean, some days aren't as busy as others, so you do have days to rest a bit more, and some days it's not everyday surgery, so some days it's just clinics. So you do get to finish early on some days as well, which does help.
Perfect. There is always a caution that people say that there's nothing that's 100% correct, or there's nothing that's 100% right. So if there was anything that you feel that there would be better, that could have been a change in the clinical attachments or electives period for you, what would you say could be a room for improvement?
I think for me personally, there's more clinical exposure.
Okay.
What I mean by that is if, for example, they can give us that clinic room to sit and speak to patients alone.
Correct.
Or examine patients alone. There's things like that, because we get to do that in the UK, so we're kind of trained a little bit for that. So it'd be quite nice to do it here as well. But I completely understand why they don't want to do that. At least they let us scrub into surgery, and we get to help out when we can. But I think if there was more clinical exposure and more patient interaction, that would be more helpful for us, I think.
Okay.
From my point of view, I don't know how it's been in neurosurgery.
Yeah, I think it's a similar agreement as well. And I think just one of the things for me was basically just trying to find out what your timetable was beforehand as well is quite useful as well. So that would help you plan out your days, and if you want to go explore the country as well, it would just help you to plan around that as well.
I think one of the reasons why there is a limited clinical exposure of you seeing patients is because everyone that works in healthcare specialty or fields here is with a license. So I think that is one of the bad draws that's happening currently. I think they could actually work on something like getting a temporary license or something for clinical attachments who have already graduated to work. But then this is again a point that everyone can work on. But then to work around this, obviously you guys know or have understood the system to understand on how to see patients even when a limitation like this arises.
Yeah, I mean, I got pretty good clinical exposure, to be honest. I think because the hospital was able to sort out an agreement. I think so. I got pretty good exposure, to be honest. But yeah, I agree with Mo. I mean, it could be that we get our own, for example, clinics and things like that. But I appreciate that's not very easy to sort out, especially on a short basis.
I know that you have been here for a short period of time, and 1 month is quite less to judge something good. But if there's something that you really like, one thing that you really liked about your rotations or attachments, what would that be?
I think the doctors here are really friendly. They're very supportive. They're very eager to teach and get to know you, and it just made the whole experience really enjoyable and fun to be in, and exciting to attend as well.
What about you, Mohammed?
Yeah, I think, to be honest, it's not much difference from the UK and the experience I've had in the UK. But it's just nice being in an Arabic country, seeing, you know, patient interaction and like in the UAE. There's actually it's very interesting to see that. Actually, I thought I'm going to be using a lot of Arabic with patients, but actually everything's in English here. So most patients who come in know English. Doctors, majority of them speak English. So it's been interesting seeing that kind of interaction between doctors and patients. And then when there's a language barrier, what kind of happens. So that's been kind of interesting. But other than that, to be honest with you, it's been very, very similar. And again, like you said, the doctors have been amazing. They're all very, very friendly and eager to teach. So I've had a wonderful time so far.
Perfect, perfect. Before we end, can we just discuss about the system in the UK and how it happens? What is the process you went through? Because as a healthcare professional, you have gone through a long journey. So how does it usually happen?
So I think in the UK it's a pretty straightforward system in that you apply to medical school after you finish high school essentially. So at the age of 18 you apply to as an undergraduate to medical school. Medical school in the UK tends to be 5 years, some courses are 6 years. And then after finishing medical school you do 2 years of foundation training. During foundation training you rotate around different specialities. And following that is when you can choose to apply for residency, whether that be surgical, and internal medicine, family medicine, etc.
And I think the process is quite long when you say that you have 2 years of internship and then you apply to a core specialty. So since you mentioned about the foundation year being for 2 years, I think that's the difference that we have in UAE and in UK, where you are already given a responsibility of a patient well early than when compared to the pathway of what we practice here. Because in UAE, we have an internship year, and then you get into a residency program that lasts for a 4 to 5 year program, and then you become registrars. But I think in the UK, you are actually working as a registrar through your residency. So you're given the opportunity to work with the patient care much earlier than what we receive hands-on.
Right, I mean obviously even when you first start off you're always supervised and there's always support, so obviously we'll see. We haven't started working yet, but hopefully it's okay.
Perfect. And thank you so much for sharing beautiful insights about the training that you go through in the UK and your beautiful short experience that you had in UAE as well. I hope UAE treated you well and you will be back here soon again. This is Yousif and Mohammed with us, who had their clinical attachments recently and shared their delightful insights with us so that we could understand much more about what happens before or when you apply for a clinical attachment or elective program in UAE. If you have any questions regarding to that, you can always put this below and we will try to answer them so that the process for you applying will become much more easy as well. Thank you so much for watching it.
Thank you.
And drop and follow as well. Subscribe.